Hello everyone, welcome to MedTeach. Let's discuss about bacterial vaginosis today. Bacterial vaginosis is a common vaginal infection caused by an imbalance of natural bacterial flora in the vagina. The concept of imbalance of bacteria is also known as dysbiosis, which refers to a disruption in the natural balance of microorganisms in the body. In the context of bacterial vaginosis, it specifically refers to an imbalance of the vaginal microbiome. Normal vaginal microbiome is usually lactobacillus dominated. A healthy vaginal microbiome is typically dominated by lactobacillus species, which helps to maintain an acidic pH and prevent the overgrowth of other bacteria. A healthy vaginal microbiome is diverse with a variety of different microorganisms present in balance. What happens in dysbiosis? That is, in case of bacterial vaginosis, what is happening? There is a shift away from lactobacillus dominance that is allowing other bacteria to overgrow. Anaerobic bacteria such as Gardnerella vaginalis, Prevotella, and Mobilencus overgrow and dominate the vaginal microbiome. The overgrowth of anaerobic bacteria leads to an increase in vaginal pH, creating an environment that favors the growth of these bacteria. Now, what are the factors that is contributing to dysbiosis? It can be hormonal changes. For example, hormonal fluctuations during menstruation, pregnancy, or menopause can disrupt the vaginal microbiome. Then, antibiotic use. Broad spectrum antibiotics can kill off beneficial lactobacillus species, allowing other bacteria to overgrow. Then, hygiene practices like douching, using scented soaps, or wearing tight clothing can disrupt the vaginal microbiome. And finally, even sexual activity, where new bacteria can be introduced into the vagina, potentially disrupting the natural balance, can also contribute to dysbiosis, leading to bacterial vaginosis. Now, coming to the symptoms with which the patient can present to you. The patient may usually complain of thin white or gray discharge with an abnormal, strong, and unpleasant odor, which is often described as fishy odor. And along with this, mild to moderate itching or burning sensations can also be seen in the vagina or the vulva. Usually, we have to perform a pelvic examination to check for the signs of bacterial vaginosis, and the vaginal discharge can be taken for testing also to confirm the diagnosis. There is one specific criteria called as Amsel's criteria for diagnosis of bacterial vaginosis, which consists of four components. The first component is the discharge will be grayish white and homogeneous. The second point is that the pH of the vagina will be more than 4.7. And the next one is that when you mix up the vaginal discharge with an alkaline solution like 10% potassium hydroxide, it will produce a fishy odor due to the release of amines acridin and putrinitine. This test is known as whiff test. And finally, we will be able to see the clue cells on microscopy. Clue cells are nothing but the vaginal epithelial cells which are loaded with the organisms. Now, how to treat bacterial vaginosis? Usually, we recommend antibiotics for the treatment of bacterial vaginosis. The antibiotic options may include metronidazole, clindamycin, and alternative treatments like tinidazole and secnidazole can also be given. Metronidazole can be given at a standard dose of 500 mg orally twice a day for 7 days. Clindamycin can be given as a cream or else a suppository. 2% clindamycin cream 5 grams intravaginally once a day for 7 days. If you are giving it as a suppository, 100 mg clindamycin suppository, one suppository intravaginally once a day for 3 days. And when you supposed to give the alternative treatments, tinidazole can be given at a dose of 1 gram orally twice a day for 5 days and secnidazole at a dose of 2 gram stat. It's essential to complete the full treatment course even if symptoms resolve before finishing the medication. Sexual partners do not typically need treatment, but they may benefit from treatment if they have symptoms. And if you find bacterial vaginosis during pregnancy and breastfeeding, remember that metronidazole and clindamycin are generally considered safe during pregnancy and breastfeeding. Hope these points about bacterial vaginosis would be helpful to you. Stay tuned with MedTeach for further topic discussions. Thank you for watching.